Hey guys, welcome back to Yoga with Leona, your site for everything about yoga and breast cancer recovery. Happy to see you again. This video is going to be about the 8 limbs of yoga. So you've probably heard me mention many times, if you've been watching some of the other videos or reading my blog posts, that yoga is really about so much more than just the physical exercises. In the Western world, we think of yoga and we just think of like skinny girls doing flexibility postures or taking pictures for Instagram, but yoga is really so much more than that. And yes, a lot of yoga is the physical practice, and it's really an important part of how the yoga practice helps us as cancer survivors to recover from many of the things that we've gone through on our cancer journey. But I really believe that the other parts of yoga are really just as important. So I want to explain to you today in the slide presentation about the 8 limbs of yoga as originally described by Patanjali in the original written texts on yoga called Patanjali's Yoga Sutras. And so I'm going to run through some slides with you where I've explained all of the different 8 limbs of yoga, and then talk a little bit about how I think each of those limbs is so important in different ways for us in our breast cancer treatment and recovery. So I'll switch to full slide screen mode so you can see the slides a little bit better. And again, as always, if you have questions or things aren't clear, please feel free to send me an email. All right, here we go. All right, guys, here we go. This is the slide presentation on the introduction to the 8 limbs of yoga. And as I mentioned, you've heard me talk a lot about how yoga asana, which is just the physical exercises or the physical practice of yoga, is really just a small part of the whole complete yoga as originally described by a guy named Patanjali in India. There's some controversy about exactly when Patanjali's Yoga Sutras were written, but sometime between 200 BC and 400 AD. And the 8 limbs of yoga as outlined in the Yoga Sutras is an 8-step path to yoga, guidelines for the practice of our life, of how we maneuver ourselves through the world with ourselves and with those around us. And this 8-step path to yoga is meant to help us cultivate health, peace, joy, and bliss in our lives. And I love this graphic at the bottom of the iceberg that shows the asanas as really just the tip of the iceberg, and the rest of yoga is all of that rest of that really great stuff that's hidden under the water that you might not know about if you haven't studied a little bit about yoga philosophy. And then on the right-hand side of your screen, this is a photograph of a mural that's painted at Dhavani Yoga here in Puerto Vallarta. Dhavani Yoga is the studio where I train and practice and study and teach. And this mural is a gorgeous representation of the 8 limbs of yoga made into a picture of a lotus flower. So I think for us as breast cancer survivors, it's so important to learn about all of the other limbs of yoga, not just the physical postures. So I'm going to lead you through some slides today, and we'll talk about all of that and how I think it can help us in our yoga journey and in our breast cancer recovery. So the 8 limbs of yoga, here is a list of all of the 8 ingredients to those 8 limbs. So the first is called the yamas, and the yamas are moral and ethical guidelines or restraints. I call them external observances, sort of how we deal with others and with the world. So how do we deal with and interact with people around us? The second of the 8 limbs is the niyamas, and these are virtues or duties, could be called internal observances. These are sort of how we deal with ourselves. And then the third one is the one everyone knows, called asana. That's the postures or the physical practices and exercises that we do to get our bodies healthy so that we can move on with the rest of the 8 limbs of yoga. Pranayama, we often practice along with our asana practice. Pranayama means breath control, and these are different breathing exercises that do a lot of different things. I'll have a whole talk about pranayama, but briefly, breath control helps us to relax our mind, relax our bodies. It helps us coordinate the movement of our bodies with our mind, and thus, bridging that gap between body and mind, helping everything to work more harmoniously. The next one is pratyahara. So this is thought of as a withdrawal of our senses or a focusing inward. It's helping us to become free from always having our attention focused outside of us. So we tend to focus on everything around us, people around us, what they're doing, what they're saying. And pratyahara is the idea of turning that focus inward to our inner self, to our higher self. The next one is dharana, or concentration. This is where we cultivate our ability to focus our attention on one point. So one-pointed focus and concentration. And the next one is dhyana, or meditation. This is sort of a step beyond one-pointed focus and concentration, in which we really connect to the object of our focus or concentration. And again, I'll have another video more specifically about meditation, different types of meditation, and how those work for us in another video. And then the last of the 8 limbs of yoga is samadhi, described in lots of different ways. Some could include bliss, absorption, union, liberation, self-realization, or enlightenment, reaching our true state of pure being. And so the 8 limbs of yoga is this whole recipe of different aspects of practice that can help us to work toward those things that we want, like better health, better physical and mental health, more of a state of wellness and happiness and joy. I watched a TED Talk one time in which a really wonderful speaker who works as a psychologist but is also a yoga teacher, she described the 8 limbs of yoga as the original cognitive behavioral therapy. So it's a real whole mind-body combination of different things that can help us. So a program to guide us toward a peaceful, blissful, and happy life. And I think as I was going through my breast cancer experience, I realized that so many of these things are so relevant to getting through that, to dealing with a breast cancer diagnosis, to dealing with treatment and symptoms and side effects, and then dealing with recovery. And so that's what I'm hoping to share with you today. So, most people, their first exposure to yoga is through asana practice, but that's okay. If asana practice is what brings you to yoga, that's wonderful. Asana practice can really help us to cultivate and learn about all of those other limbs. So even without realizing it, our asana practice helps us to develop all of those other things. So as a few examples, asana clearly promotes pranayama. It's almost like you can't do an asana practice without some ability to control your breath. Asana also really is basically a moving meditation. So it helps us cultivate that concentration and focus, bringing us into that state of meditation. It's really honestly my favorite type of meditation. I still struggle with seated meditation, but moving meditation, man, it's amazing. And then all of the yamas and niyamas are found in asana practice, and I'll go through some of those in a coming slide here. So this is a wonderful quote from a famous yoga teacher named BKS Iyengar, which I think sort of states it so eloquently. He says, "The study of asana is not about mastering posture. It's about using posture to understand and transform yourself." So we do asana practice, all of the physical postures, but really that's not the most important goal of yoga. It's how that practice of the postures really helps us to understand more about ourselves, to get more in touch with ourselves, and to arrive at a new, healthier, transformed version of ourselves. So there's no specific order in which you have to approach the 8 limbs of yoga. I have some friends who started with meditation before they ever got into yoga asana practice or anything else. It's truly a holistic system in which each limb can help affect and influence the others and help you as you progress in all of the areas. So each limb can help us in different ways in many aspects of our life. And some of the limbs may resonate more with you than others, and you should just work with what works for you at this time. And you may find that over some time of practicing asana, you'll get more interested in the pranayama, or you'll get more interested in meditation, or the different ones, will become more or less relevant to you. So yoga is here to help you in whatever place you are. So again, from the beautiful mural at Dhavana Yoga, here is a picture of the yamas and the niyamas. So you can see on the left-hand side of the screen, the yamas, these are the moral qualities or the external observances. These are the things that help us connect to our true self. The first one is ahimsa, or non-harming. That one's pretty self-explanatory. I think it's important to recognize, though, that these yamas and niyamas can be relevant to the way we interact with others, but also relevant to the way we interact with ourselves. So I'll talk about ahimsa not only to others, but maybe most importantly to our cancer journey as non-harming of ourselves and non-violence to ourselves, both in our bodies and our minds. Satya is truthfulness, so not being mistruthful with ourselves or with others. Asteya is non-stealing or respect for others' property. Brahmacharya is described in several different ways, and it sounds like originally a long time ago related to celibacy or moderation of sexual energy, but in modern times is really described more as moderation or right use of our energy in general. So not so much related to sexual energy or that sort of thing, but how we use all of our energy. And of course, this is super important as we go through a cancer experience. And then the last of the yamas is aparigraha, or non-attachment. So the idea of not being so attached to the way we think things should be, the way we want things to be, or the way that's easiest for us. A lot of yoga philosophy talks about how attachment is really the root of a lot of our suffering. It's not really what we're going through that makes us suffer so much, but how we allow our minds to make us suffer, because we are so resistant to whatever it is. We keep telling ourselves, I hate this, or I don't like this, or I don't want to go through this. And if we can just loosen that attachment a little bit, a lot of the suffering can melt away. And then here on the other side are the niyamas, or the internal observances, the guidance for our individual conduct. So the first one is saucha, and that relates to purity or cleanliness, also could be described as positivity. So this can relate to purity and cleanliness of our body, but also of our minds. The second one is santosha, or cultivating contentment. So again, this one relates a lot to aparigraha in my mind, not being so attached to the way we think things should be, but learning to be content with the way things are. The next one is tapas, or self-discipline. This is sort of what drives us to do the things that we know are good for us. So this is what helps us to get on our mat and do our yoga practice, or maybe to take our medicine, or to do the things that we need to do for our cancer, sometimes described as an inner fire. The next one is svadhyaya, or self-study. So I think most of yoga is really some aspect of self-study. So it's about helping us understand ourselves a little bit better. Why do we do the things we do? And, why do we sometimes do things that we know aren't good for us? Or what drives us to do the things that we know are good for us? And as we cultivate svadhyaya, or self-study, we can really understand ourselves better, and that helps us to make better decisions and to, move forward with our lives in healthier ways. And then lastly, the last of the niyamas is Isvara Pranidhana, which can be described in several different ways. Can be described as surrender. So surrender to our situation, surrendering the results of our actions, or surrendering perhaps to a higher power if you believe in that. Surrendering and trusting in the universe, trusting in our experiences and our situations. So those are the yamas and the niyamas. So let's talk about how the yamas and the niyamas come up in our asana practice. So y'all have probably been doing some of the yoga practices, and let's see if any of these resonate with you. These are ones that I think of a lot. So ahimsa, as I mentioned, is non-violence. And so an important idea in yoga is ahimsa for ourselves. So not hurting ourselves, trying to push our bodies too far. So trying to touch our feet to our head or stick your leg behind somewhere that you feel like it's not ready to go yet. So we have to remember nonviolence and always listening to our body and taking care of ourselves rather than pushing ourselves too hard and ending up with injuries. Also, ahimsa are nonviolence in our thoughts. So we want to avoid violent thoughts toward our body. So sometimes I find myself saying, geez, why am I not more flexible? Why is my back like that? And, those really aren't healthy thoughts. So we want to try to avoid those violent thoughts toward your body. How about brahmacharya, or right use of energy? So this one's so important, knowing when to push, when you've got a little more energy, and when to instead back off. So when you need to relax a little bit more. You've heard me talk about sthira sukha. This is that balance between effort and ease, or sometimes we call it effortless effort. The balance between steadiness and ease, balancing strength and intensity with joy and comfort in our practice. So this is really a key aspect of yoga asana. How about aparigraha, or non-attachment? Boy, this is a big one. So how about non-attachment to what we perceive as perfection in asana? So we might see these skinny model types doing various yoga postures on Instagram, and we perceive that as perfection, and we really need to learn not to be attached to those ideas. We need to remember that wherever we are in our asana practice for any given day, that is perfection for us. That's the right place where we're supposed to be and where we're getting all of our own benefits. How about santosha, or contentment? So learning to be content with where we are in our asana practice, recognizing that we're doing just what is needed for our bodies on any given day. And svadhyaya, or self-study. So what do you learn about yourself as you practice asana? What makes asana harder or maybe easier for you? And what does that tell you about yourself? Do you like a really vigorous, physically demanding yoga practice, or do you prefer sort of an easier, more relaxing practice? And what does that tell you about your personality, and how might that relate to how you approach the rest of your life? I know what it means to me. And then lastly, Isvara Pranidhana. How about the idea of surrendering your body a little bit in a given posture? So often we're sort of straining too much, and I think we can get into our own way. And if you can relax your body and just surrender that muscular effort a little bit, you'll feel yourself relax into the posture, and you might gain a little bit more depth. How about surrendering the fruits of our practice to a higher power, or maybe even just surrendering to rest when we know that's what our body needs? Now let's talk about all right, how about the Yamas and Niyamas in breast cancer? So ahimsa, let's talk about ahimsa here. Again, avoiding violent thoughts or anger at ourselves or at our body. So I remember patients saying, oh, I'm so angry, I can't believe my body did this to me. Why would this cancer happen? And while that might be a natural thought that would arise, I think it's helpful to realize and recognize that that's really violence against yourself, thinking in that kind of way. So we try to avoid these violent thoughts to ourselves. How about brahmacharya, or right use of energy? So learning to rest, giving yourself the permission to take it easy when you know that you need the rest. Maybe you're in the midst of chemotherapy and you're feeling a little weak and fatigued. So in those times, we need to give ourselves permission to sit on the couch and rest when we need. But then also recognizing when we're starting to build a little strength and we could push ourselves to start to recover a little bit. So recognizing that balance and seeing really when you need rest and when you've got more energy, that's brahmacharya. Or aparigraha, non-attachment. Boy, this is a big one, I think, in breast cancer recovery. So how about non-attachment to our physical appearance? So we get so hung up about our hair loss or our scars or what our breasts look like after surgery. I know I'm irritated that mine are really super asymmetric because of radiation fibrosis, but I'm working on that. I'm trying to not be so attached to how it looks. How about non-attachment for just our desire for how things should be? I remember being really frustrated when I had chemotherapy delay related to maybe the doctor couldn't get the medicine at the right time, or my labs were delayed, or maybe I was anemic or something like that. And, that just allows you to get angry and causes more unhealthy emotions. So if we can learn to not be so attached, to kind of take things as they go, I think that we can get through our breast cancer experience in a lot healthier way. Santosha, really the same idea. So learning to be content with whatever our situation is. So finding contentment despite our chemotherapy side effects or our surgical outcomes, accepting our situation rather than resisting it or fighting it. And again, that idea of, really so much of our suffering comes from our mental framework, our sort of resistance against it, and our fighting against the situation that we're in. So if we can release that resistance a little bit and find some contentment, we can really be a lot happier and find more grace and peace as we go through this difficult situation. How about svadhyaya? So self-study, learning about ourselves through our cancer experience. Boy, I really think this is one of the best things that came out of my cancer experience. I learned so many things. What did you learn? Maybe a little bit about being more patient. I'm like the most impatient person in the world. You could ask my husband. But I learned to be a little bit more patient through my cancer experience. What about surrender? The things we've been talking about, non-attachment. How about learning to accept help from others? There's so many things that we can learn through our cancer experience that can help us be better people. And lastly, Isvara Pranidhana, surrender. So surrender maybe to a higher power or to the universe or to whatever it is that you believe in. Recognizing that we can't control everything and that we shouldn't want to control everything. This can be a big one in getting through a breast cancer experience. Recognizing sometimes there's some grace behind the experience as above, like maybe we learned something wonderful that helps us be a better person moving forward. Isvara Pranidhana can be trusting in the process. It can also be sometimes surrendering to our discomfort or to our suffering. Sometimes we have a symptom or a side effect that really just the medications don't help very much. And instead of really struggling against it or fighting against it, just breathing and surrendering into whatever that discomfort is, honestly can sometimes really transmute that suffering into more a sensation of peace. All right, so how does all this relate to medical and psychological research? So I've done a bit of reading about, what qualities in a breast cancer survivor help to predict how well they get through the experience. And so our coping mechanisms, so whether you have positive or negative coping mechanisms, whether you have some ability to be optimistic, whether you have something called self-transcendence, which means recognizing a bigger picture or a higher power. All of those have been well studied in clinical trials and correlate to emotional well-being and overall quality of life in cancer patients, as well as those with other illnesses besides cancer. But I think all of those things could correlate back to some things that we learned from the Yamas and the Niyamas. So I think if we can study the Yamas and the Niyamas and pay attention a little bit to how they might affect how we're interacting with ourselves and with our situation, if they can help us, have more peace and grace as we go through this cancer experience instead of struggling so much with it. I talk in other videos about a program called the Mindfulness-Based Stress Reduction Program and all of its amazing benefits in cancer patients and other medical situations. And that program, as you'll see if you go back and look at that video, includes a lot of these similar ideas. So again, going back to the idea of the 8 limbs of yoga as the original cognitive behavioral therapy. So all of these things are things that are used in practice with psychologists and therapy and things. So we can find it right here from our yoga practice. So what about the other 8 limbs in asana practice? So pranayama, as I mentioned, You almost can't do asana without doing some aspect of pranayama. Our conscious breathing calms us in asana, so when you're in a really difficult physical posture, if you come back to that deep, slow breathing, it relaxes you and allows your body to stay strong in the posture. Pranayama helps us relax our muscles, it promotes strength, and it improves oxygenation, all of which help our asana practice. Pratyahara, which is that withdrawal of our awareness inward, withdrawal of sense perceptions, turning our focus inward, that all helps us focus during our asana practice. It improves our balance. You know, you can't balance on one foot if your eyes are darting around the room and looking at things around you. So the more we're able to withdraw our awareness inward, the better we can do in our asana practice. Dharana, or focus and concentration, obviously the same thing. Easier to perform each asana or the flow of an asana practice if we can focus and concentrate on what we're doing. It helps promote balance and strength, both of our minds and our bodies. And then dhyana, meditation, as we improve our focus and concentration and we continue in our asana practice, everything outside the practice melts away. And the asana practice becomes a moving meditation as we really become one with what we're doing. How about the other limbs in breast cancer? So pranayama, of course, conscious breathing, again, just as it relaxes us in asana, it can relax us as we're going through our cancer treatment. Maybe it can relax you while you're sitting in the chemotherapy chair. It could relax you while you're standing in line waiting to have a PET scan and you're feeling really stressed out. It can relax you while you're sitting at home feeling some side effect. It can ease pain and nausea. It also stimulates the flow of blood and lymph. So we know that deep abdominal breathing is a big part of lymphedema therapy. So the more we practice pranayama, the more we help stimulate the return of lymphatic fluid from our arm and shoulder. How about asana practice in breast cancer? I'm going to have a whole video on this, of course, but you can imagine the many benefits of asana practice in improving flexibility and strength, in relieving pain that might be related to scar tissue and fibrosis, at reducing symptoms of lymphedema, and etc. So for more on that, refer to that video. How about pratyahara and dharana? So the idea of withdrawing the sense perceptions and focusing and concentrating. All of these can relieve anxiety as well as physical symptoms that we go through as a result of our breast cancer treatment. They do that by focusing our mind away from those myriad thoughts and fears and physical sensations toward whatever it is you choose to focus on. Maybe that's a mantra or a prayer. Maybe that's your breath or whatever it is you choose to move your focus to. If you can move your focus away from the physical sensations, the side effects that you're having, your experience will be improved. And finally, dhyana, there's been extensive literature looking at meditation in cancer survivors, showing that it relieves fatigue and anxiety, that it reduces fear of recurrence, and has many other benefits in cancer patients. So all of the other limbs can all help us as we go through our breast cancer experience. So the 8 limbs of yoga in breast cancer, I just want to make sure everyone understands that the true practice of yoga is so much more than just the asana, that the study of all of those 8 limbs can really help us in our cancer recovery in so many ways, and that it will help us find more peace and joy and bliss, both with ourselves, with our situation, and with those around us, which of course is so important. Finishing quote from Eckhart Tolle, who's one of my favorites, and he talks about so many things that relate back to yoga philosophy. He says, non-resistance, non-judgment, and non-attachment are the 3 aspects of true freedom and enlightened living. And I think that's just almost captures a lot of what I'm trying to share with you. All right, guys, thanks for watching this video on the 8 limbs of yoga as it relates to breast cancer recovery. I hope you learned something interesting and you were able to think about a couple of different ways maybe that yoga practice and yoga philosophy can help us achieve a healthier mindset, help us reframe the way we think about our cancer experience, and all of that can help us get through our breast cancer treatment and recovery with a little more ease, a little more grace, with a little less suffering perhaps. So again, hope you enjoyed it. Please feel free to reach out if you have questions or anything, and I'll see you in the next video. Namaste.